Hi everybody, it's Dr. Tim Newton with Inspire Movement Physical Therapy. In this video, we're going to show you what we do for people who have ankle pain and ankle sprains. Alright, so for the ankle, we need to make sure that we've got good mobility above. We forget this all the time, but if the mechanics of the tibiofibular joint, if that is not normal, we can't expect anything down here to move properly. So we want to make sure that this entire area here mechanically is sound. We start actually at the knee. We want to make sure that the tibia can rotate in and out on the femur bone. Okay, there's a little bit of play there that occurs when we bend and straighten our knee and we're moving around. That's critical for what stresses go down to the ankle. If this guy is not doing his job, all the stresses go here, and then we can have persistent problems. We show you in our knee treatment video how we deal with that rotation restriction. Check it out under our knee treatment. But we've already done that, so now we're going to focus on the tibia and the fibula, which is kind of parallel right to it. So the tibia is on the inside of the knee here, so I've got that. And then the fibula, and it's the top of the fibula. Both of these bones run all the way down to the ankle. The fibula is out here, okay? And I can move the fibula on the tibia. And I can feel for a little bit of joint play here, okay? And if there's a restriction here, she doesn't have a significant one, but if there were, we're going to show you now how we mobilize that. All right, so I can always just push forward and backward and kind of stretch out a little bit, and I'm moving my hands up and down the shaft of the fibula. And I can kind of stretch things out that way and localize to wherever I feel the restriction. We can also take advantage of muscle tension as part of this in a muscle energy technique. So we're going to show you that right here. I sit on her foot and stabilize it. Again, I stabilize the tibia, so that way we're very focused on exactly what we're doing. And if the fibula doesn't like to go backward, okay, if I'm pushing and it doesn't like to go backward, I feel a restriction there. I'll have her, I'll ask, okay, go ahead and push down with your foot like a gas pedal into the table. We're kind of using her own muscles to pull that bone back a little bit because the muscle is attached to the back of the bone, and when it contracts, it helps pull it back the direction I want. And I'm also pushing along with it. And relax. So I reassess, feel for more play, push down again. All right, she's contracting, I'm helping by pushing myself. Relax. And one last time, go ahead. None of this should be painful for her. And relax. Okay? So that's going backward, okay? And then coming forward, that is the opposite, right? Opposite direction, so we use the opposite side muscles of the shin. So now I pull it forward as far as it likes to go. You can kind of see how my hand is moving there. And now I ask her to lift her toes up into my leg. And I'm blocking. And I'm just pulling the bone. And relax. My leg is blocking her toes. Okay. And I'm also just honing in on exactly where I feel the least amount of motion. Again, like I said, she's moving pretty well. But if I felt it more down at the bottom, I could focus the treatment there. Okay, go ahead and pull up again. And we just repeat this. So these are the techniques that we like to use to get the tibia and fibula moving on each other, and relax. All right, and once we're done this, then we direct our treatment down to the ankle itself. All right, so after we've treated the tibia on the fibula, okay, we've treated those two bones and the restrictions between them, we move down to the regular ankle itself, okay? There are a couple of different bones here. A big one right in here is called the talus, all right? And that's basically like the bone on the top of the foot. And at the end of the shin bone, this talus articulates, Okay, it articulates and rolls and slides like this, and that rolling and sliding is what's happening as our foot goes up and down. All right. The big restriction that we see in this joint is that it has trouble going back. Okay, it has trouble going back as we bring the foot up into dorsiflexion. So we see restricted dorsiflexion and a decreased, what we call a backward glide of that bone. This is a very common problem, particularly in people who have had ankle sprains, where the ankle rolls like this. When this happens, everything, including the fibula, the talus, and another bone called the calcaneus, they all get pulled forward and inward. And a lot of the time, they never completely return to their original position. Now, this is a big, big problem because when this talus is doing what it's supposed to do, when it goes backward and really sits underneath the end of the shin bone, the joint is stable. But if it never goes all the way back, right, and if it's not going all the way back like this, but instead only gets to here, the ankle is not in a fully stable position. It cannot achieve it. So what you get then is a recurring rolling of the ankle, a recurring laxity and instability of the ankle. And this is a big thing behind recurrent ankle sprains. We need to get the bones to go back to their original and stable positions. Now they're supposed to move forward and backward, but if they can never move back into that stable position, that's where the problem comes from. So we're going to show you how we address this here. All right, so what we're going to do here, our goal, is to get that talus to go backward, to go posteriorly. So what we're going to do is a muscle energy technique for that. I just hold the calcaneus, that's the heel bone, we'll talk about that next, here for stability, and my fingers are on the talus and I'm monitoring its movement. All right? Now, I don't want to try to take this thing as far as it can possibly go, because by that point, the talus has already stopped moving, and it's the other bones of the midfoot that are starting to wind up and move themselves. I'm focused on this bone alone, okay? I'm not going to try to take it to end range and beat it into submission. By that point, all of her muscles have already kicked in a protective response. They do not want me pushing any farther, and I'm not going to get anywhere. The only thing that will get mobilized is my own hand, and it probably won't feel too good. So I'm focused on this bone, and specifically where this bone, the talus, stops moving, okay? So I know there's a restriction in dorsiflexion, so I take the foot as far as it goes, and right here I feel the talus lock up. Now note, I can take this foot farther, but it's coming from the other parts of the foot, not the talocrural joint, all right, where that shin bone meets the talus. So here's where I'm at, okay? And I ask her to just gently push her foot down into my leg and relax, kind of like a gas pedal, and then I take it a little bit farther. There's a little bit of fine tuning on exactly where this is happening. There are a little bit of angles. There's a little bit of an angle in and out that I'm also playing with, but mainly I'm pushing backward. Push down again like a gas pedal. Let it go. I'm just blocking that with my thigh, her effort. And these fingers here are following that talus bone. One last time, push down and relax. Okay, so I've used her muscle contractions in a muscle energy technique to take the talus back farther to get more dorsiflexion. Okay, now we're going to show you the next joint down. The talus is right here, and the bone right beneath it is the calcaneus. All right, it's the heel bone. All right, it's the one that we always feel when we're walking. That can also get restricted, and just like in the joints above, when we have that rolling of the ankle, it very often gets stuck, rolled inward. Okay, it should be able to come out, but it gets pulled inward. So our goal in most cases, is to restore mobility going out. Okay? There are several different ways that we can do this. We can do a muscle energy technique just like we did in the joint above. All right? We can do that contracting and relaxing to get that. We could also do even a high velocity, quick thrusting movement, the joint cracking and all that stuff. But what I'm going to show you here is something a little bit different, and it's a little more gentle for those of you who have a lot of pain in the ankle. This is called an indirect technique. Okay? So whereas the muscle energy technique we just showed you and a high velocity thrust joint cracking sort of thing is a direct technique where we take it right where we want it to go, right? The joint doesn't move to the left and we say, okay, we're taking you to the left anyway. Here we say, okay, joint, you don't want to bend toward the left? Well, we'll take you where you like to be. We'll take you to the right a little bit. We'll take you to your happy place. So I'm going to take that calcaneus and stabilize the bone above it, right? Because the joint is between these two bones, this talus above and the calcaneus below. And I just support her leg here. And then what I'm doing with my bottom hand is I'm scooping it out and bringing it back in. And I'm just trying to feel what direction does that calcaneus really like to go. And oftentimes it likes to go in way more than it likes to go out because it's stuck rolled in. If you have a history of ankle sprains and recurrent ankle issues, this is probably a problem for you. Okay, and now I just let it stay here and sort of decompress. It's in its happy place. I'm not creating any pain. I'm not pushing it in a direction it doesn't want to go. And it seems really, really boring. But what is happening here, and it's really amazing, and I can start to feel it with her already, there's a small amount of moving that is starting to happen with this bottom bone, this calcaneus. What is happening is a myofascial release. This foot, for the first time, is in a position where it is not being pressured, where it's being decompressed. And it is letting me have a little more movement. The muscles and the fascia are all releasing and relaxing. And my goal from this is to get a little more mobility. Getting the heel to be able to swing out to the side. It didn't want to swing out to the side. Another word for that is eversion. It didn't want to evert. But now it's starting to release and I can feel it going into that eversion movement. That heel is going out to the side a little bit. So it takes a little bit of patience. But this can be a very, very potent treatment technique. And it's amazing too. Sometimes I'll do this on people's feet and we'll get this popping and cracking. And it looks like I'm doing absolutely nothing to the foot, but you can hear and feel pop, pop, crack, crack. And it's just because things are releasing that way. And I didn't have to do a quick thrust. So that's another alternative that's really good to help with foot and ankle mobility. All right, everyone, you saw how many different things that we can do for those ankle pains and recurrent ankle sprains. If you found this video helpful, leave us your questions, your comments, subscribe, and give us a like. And don't forget to check out our website for more related material at marylandmanualtherapy.com. Thank you, and have an inspired day.